In patients with obstructive sleep apnea, continuous positive airway pressure CPAP is used to keep the airway open during sleep. However, the required CPAP pressure differ from patient to patient depending on the factor like body weight, neck size and disease severity. To simplify pressure titration, a mathematical formula has been derived that can estimate the ideal starting CPAP pressure. So formula is predicted pressure in centimeter S2 is equal to 0.16 into BMI plus 0.13 into neck circumference NC plus 0.04 into AHI minus 5.12, whereas BMI is the body mass index in kilogram per meter square, NC is the neck circumference in centimeter, and AHI is the apnea hypopnea index in 1 hour. So why this? You have to deduct the minus 5.12. It is a constant correct for baseline airway resistance in normal individual. For example, let's calculate predicted CPAP pressure for patient with BMI 30, neck circumference 42 and AHI 45 units. This formula gives predicted CPAP pressure is about 6.94 centimeter H2O. So roughly it will be 7 centimeter H2O for CPAP for OSA cases. So by this formula you can calculate the predicted CPAP pressure for individual patient. This formula is rough estimation and this can be used where polysomnography is not available. It helps setup of initial CPAP pressure before fine tuning or follow up for individual patient. Average CPAP pressure generally ranges between 5 to 15 centimeter S2O. So you can roughly calculate the range for individual by this formula. Another method is split night study. If a patient undergo overnight polysomnography, the first half of the night is used for diagnosis of OSA and the second half is used to titrate CPAP pressure once OSA is confirmed. This is called split night study of this individual cases. So by these two methods, you can roughly estimate the CPAP pressure for individual case. In conclusion, this predictive equation provides a scientific and practical method for estimating CPAP pressure when titration studies are not feasible. It individualizes therapy and improves patient comfort and compliance. This is a reference from Scott Brown. So, this is the evidence based medicine.